this short video I am going to talk about lumbar canal stenosis. Probably lumbar canal stenosis is one of the most common conditions that an elderly population presents to a spine specialist. So what is lumbar canal stenosis? Lumbar canal stenosis is usually a combination again of age-related factors which together result in a reduced space in the spinal canal and reduced space for the nerves, causing some amount or a varying degree of compression on the nerves that come to the legs. So what is the spinal canal? Let us understand this a little more. What is a spinal? Spinal canal is basically a canal that runs all the way from our head to our waist. This is a canal that is confined on all the sides by bone. This is together called a bony ring and runs all the way from the top to the bottom, transmitting the nerves or the spinal cord up to a certain level. Now, in between each vertebra in the spinal column, there is also a small hole or an opening on the side which is called the foramen. So, a lumbar canal stenosis that usually happens in the lower back can result from either a compression or a decreased space in the main canal, or it can also happen due to a reduced space in the foramen or the holes through which the nerve comes out and goes to the leg. So what causes this spinal canal stenosis or a lumbar canal stenosis? So it's a combination of factors, as I've already mentioned. So usually from the front, the disc prolapse can be there, the disc bulge can be there, which can be of a varying degree, that compresses from the front. From the sides, there will be the facet joints which become bigger as we age, and that also reduces the space for the nerve. And from the back, there will be the ligament. The ligament that attaches between the two bones called the ligamentum flavum. So that becomes thicker as we become more older, and from the back that compresses. So from all the three sides, so there is a compression on the spinal canal. So what do these patients present with? So usually they present with what is classically known as a claudication symptom. So claudication symptom is nothing but because of the reduced space for the nerves fatigue very easily. Usually the patients walk for a certain distance, and after that they start developing some cramp-like sensation in the legs, or some in cases numbness in the legs, due to which they will have to take rest or they will have to sit down. If they sit down for around 5-10 minutes, again they will be fine and they will be again able to walk for a couple more, further some more distance. So this symptom is usually progressive. It starts as a very minor symptom and it becomes more and more progressive as the person ages or as the disease progresses, so that in a later stages persons will not be usually able to walk even for 100 meters or even 50 meters. And in even severe cases, these kind of pain can come even while sitting, while standing, or even while lying down, which is called a rest pain or rest numbness. So these kind of symptoms are again more common in lumbar canal stenosis. Of course, the other symptoms that are there, that are back pain as well as radicular pain or what is called as sciatica, can also be there in a case of lumbar canal stenosis. So lumbar canal stenosis is usually diagnosed by an MRI scan, which is going to pick it up, and the doctor will be able to tell you what is the finding or what is the severity of the stenosis that you have. So most of the cases in early stages, conservative treatment is enough in case of lumbar canal stenosis. But in severe cases, whenever there is a significant progression of your symptoms, when a critical distance that is reached, if you are not able to walk even for 100 meters, that is what we tell as a critical distance, though there is no actual cutoff. But if you are not able to walk even for 100 meters, that indicates that yes, this is a case that requires some kind of an intervention. Also, if patients develop any kind of a numbness or a weakness, or in case there is already some kind of a urinary disturbances, these patients again will require a surgical intervention. Well, surgery can be done in different ways. A conventional open surgery was what was done traditionally, but these things can be done in present day era with minimally invasive spine surgery or even an endoscopic spine surgery, where the incisions are smaller than 1 to 1.5 centimeters, and the patients recover quite faster, get back home on the second day, and they'll be able to get back to their routine activities after 1 week. So in lumbar canal stenosis, the most important thing we have to understand is, again, it is age related. This is usually a progressive disease, and treatment like surgical intervention will be required only in a small proportion of cases who do not respond to conservative treatment and in whom the symptoms progressed beyond a certain point.